Hello everyone, Dr.Suresh here, Professor of Biochemistry, and I am Biochemistry Educator for NEXT, NEET PG, FMGE, USMLE and PLAB Part 1. So, the main purpose of this recording is to explain in detail about the next exam that has been proposed by the National Medical Council of India. And regarding the next exam, NMC has conducted webinar across the country throughout the colleges participated in this. So, in this 1.5 hour webinar, the rules and regulations and the probable dates, the probable marks and the eligibility criteria and the qualifications and the PG allotments has been explained in detail, but it is still puzzle or misconceptions there in the people who are not understanding it properly. So, to avoid those confusions and queries, I have come up with this video, and in this I try to simplify whatever the rules and regulations and probable dates and the qualification criteria regarding the next exam. So, the next, as we are all aware that national exit test for the MBBS undergraduates, it is like licensure exam as well as it is the qualifying exam for your PG, I mean postgraduate seat. So, next our national exit test for MBBS will be a single window exam which will replace NEET PG. So far we have NEET PG, and this is the last year, I mean what to say, 2019, whatever the CBME implemented undergraduate courses which will be eligible for the next exam. So, next our national exit test for MBBS will be a single window exit exam which will replace NEET PG, INICET which will be conducted by AIIMS, and PGI Chandigarh also have their own individual competitive exam, JIPMER, NIMHANS and MCA screening test, that is FMGE, for foreign medical undergraduates. So, next will be implemented from December 2023. So, regarding this, maybe there are certain news spreading across the social media that mock test will be conducted at the end of the July. So, next will be implemented from December 2023. Knowing the question paper pattern and subject wise marks distribution of next exam will help you to design your study strategy to prepare for next. Next will standardize the medical education in India. It will judge the conceptual understanding and problem solving skills of final year MBBS students. Next will comprise of two parts according to the rules and regulations. One is like theory next one and practical next two. So, what are the next one and next two, we will see in detail. So, next step 1 exam will replace final year MBBS exam. Present final year MBBS exam is conducted at the level of universities, which will be replaced at central level. So, next one will be conducted centrally at all India level. Thus, students will appear next one exam after final year and before starting their internship. The students who will pass next one exam will start their internship. Otherwise, if you doesn't qualify the next one, you are not eligible to participate in the internship. You have to give again the next one and you have to qualify that next one and you have to take the internship. Significance of next one exam will be the qualifying cutoff for next one exam will be 50%. Thus, if you score 50%, it's not percentile in next one, you will be considered pass in next one and you will be eligible to start your internship. Okay. The score obtained in next one will be considered in allocating PG seats after internship. Again remember, next one whatever the scores you are getting is considered allocating PG seats after internship. The score of the next one exam will be valid for 3 years for the purpose of PG entrance ranking. So, this is the model already the western countries are following up. If suppose if you take USMLE or INBD for dental exam, so once you give the test scores are eligible for next 3 years. Throughout these years, anytime you can, based on the type of the school, you can apply and take the seat in the concerned school. So here, after completion of your internship, you have to do all these procedures. You can apply for PG with the same next one score within 3 years of appearing next one exam. Thus, next one will be unlike next two, which will be practical exam. Next one will be a theory exam. So all 19 subjects in new Indian MBBS CBME curriculum will comprise the syllabus for next one exam. Thus all preclinical, paraclinical and clinical subjects taught from first to final years will contribute questions in the next one exam. So pattern, if you see the next one exam, so next one will comprise of theory questions in the form of multiple choice questions with a single correct answer. All 19 subjects in new MCA CBME curriculum will be included in next one exam syllabus, but subject wise mark distribution will be drastically vary or different than what it was in the NEET PG exam or MCA screening test for FMGE. So screening exam for FMGE people, okay, it was again the proportionate of marks are like it's not uneven. So clinical subjects will be given more priority compared with the pre-paraclinical subjects, but this confusion has been avoided with the next one exam. The clinical subjects will carry disproportionately more marks than pre and paraclinical subjects in MCA screening, which is not which you cannot expect now in next. So if you see the marks distribution like major subjects, allied subjects and total MCQs, we will see. So major subjects like medicine, dermatology, psychiatry, so they carry 120 marks, whereas pediatrics carry dermatology, pediatrics 60 marks, medicine 120 marks, dermatology 60 marks, psychiatry 120 and then again psychiatry 180 marks. Surgery, if you see surgery like major subjects like orthopedics, anesthesia 120, ENT 60, 180, obstetric and gynecology, radiology if you see 120, ophthalmology again 60, 180. So total MCQs for major subjects, clinical subjects is 540. So among above 540 MCQs, 10% MCQs from each stream will be from basic applied sciences, anatomy, physiology, biochemistry, microbiology, pathology and pharmacology. 10% of MCQs will be from preventive and social medicine like community medicine. Among above 540 MCQs, 60% will be problem solving, 30% will be comprehension and analysis type and 10% is like recall. So attempts in next exam, if you see, you have to qualify next exam step 1 and 2 taken together within 10 years from the date of your MBBS admission. Apart from this, there are no restrictions on number of attempts of next exam. This 10 years limit is only for the passing of next exam. This 10 years limits only for the passing of next exam. Remember, again I am stressing this. This 10-year limit is only for the passing of next exam. For PG entrance purpose, you can attempt next one exam unlimited sessions or unlimited times. So next step 2, if you are coming, next 2 will be the practical exam conducted at the level of university. So not all India level as next one. So here what to say, next one will be at the all India level and next 2 is at the institute level. So you will have to appear next 2 exam after your internship. So the major difference here, next 1, next 2, next one is before starting of your internship and next 1, next 2 will be after internship. So you have to appear next 2 exam after your internship. So you will have whole 1 year of internship to prepare for your next 2 exam, which is practical oriented. It's not a theory based. So which will be like pass or fail exam. Unlike next 1 exam, next 2 will not carry any score or marks. So thus next 2 exam will not contribute to PG seat allotment. It will be just a qualifying exam. It is like a licensure. Okay, whether you have to practice or not, that will decide by the next 2. So next one is for your qualifying exam for your internship and your PG allocation, and next 2 will be like your licensure exam after your internship. The practical exam will decide if you pass, you are able to practice, otherwise again you have to clear or appear for next 2 exam. So throughout the webinar, whatever the key points I have noted, I have explained here. Hope this session, this video helpful to you, understanding the norms, rules, regulations laid by NMC for the next 1 and next 2. So that's all from my side regarding on the next exam. Thanks for watching. Thank you.